Hello students, welcome to another lecture on general surgery instruments. I am Dr. Manoj. So before starting the lecture, we'll discuss some general points about the instrument. So you should know all the instruments are made up of stainless steel and they are mostly sterilized. Most of the metal instruments, stainless steel instruments are sterilized by autoclaving. There are various methods of sterilization. What is disinfection? What is the difference between disinfection and sterilization, that you should be knowing? An examiner can ask you in your exam. And then next point is important point is, how do you describe an instrument? So an instrument given to you in your hand, you are supposed to speak in certain format that we'll discuss in the later slides. So what is disinfection? Disinfection describes as a process that eliminates many or all pathogenic microorganisms. Mind it is all pathogenic organism except the bacterial spores on inanimate objects, on inanimate surfaces. It can be of three types. One is low level disinfection or disinfectant, intermediate level disinfection, and high level disinfection. So what are the difference between these three types of disinfection? Low level disinfection, in which most of the vegetative bacteria, some fungi and some viruses are killed in less than almost 10 minutes. Intermediate sterilization or disinfection means in which you kill the microbacterium, vegetative bacteria, most of the viruses and most of the fungi are killed, but it does not essentially kill the spores. Third is, it kills all the mycobacterium, bacteria, viruses, fungi, everything, every organism except the spores. So the process which kills the spores also is called as sterilization. Methods of disinfection. There are various methods of disinfection of the surgical instrument. One is air disinfection in the form of aerosol of glycol. Commercially available is propylene glycol and triethylene glycol. Next is alcohol based disinfection, that is ethanol or isopropyl alcohol, which we normally use in our day to day practice. Aldehyde form, formaldehyde, glutaldehyde gas, orthophthalene gas also is also available, and oxidizing agent like sodium hypochlorite, hydrogen peroxide, phenol like chloroxenol is a primary ingredient that is present in Dettol. Ammonium quaternary compounds like benzalkonium chloride, citramide solution, that is commonly called as the Savlon solution, that is present in your OPDs. Inorganic compounds like chlorine and iodine, that is povidone iodine, that is very effective in high level disinfection. Method of sterilization. What is sterilization? Sterilization is the process of complete elimination or destruction of all forms of microbial life. That means it includes all the bacteria, pathogenic, non-pathogenic bacteria, fungi, mycobacterium, your viruses, all type of viruses, and including spores. So in all other processes, as in your low level disinfection, high level disinfection, spores was not destroyed, but in this sterilization, when the spores are destroyed, you call it as a sterilization, because you remove all microbial life. It can be of various types. One is physical sterilization by help of the physical method. Next is chemical sterilization. Use some chemical to destroy, to change the chemical molecular structure of this organism. And third is mechanical, by filtering the patient. So one is physical. Physical, you can use dry heat to destroy the tissue. You raise the temperature so and so that the life in the on this thing is destroyed completely. Example is hot air oven. Hot air oven can be used for sterilization. Next is you use the moist heat, that means steam, vapors of water, so that penetrates the tissue of the microorganism and destroys the structure better. So the example is the autoclave, that is the most commonly used method for doing a sterilization of the surgical instrument. Next is radiation by UV rays or by ionizing radiation like gamma radiation. These are a bit expensive, so not used in an hospital setup, but these are used for a commercial purposes. So in case you want to sterilize tubings, some sutures, or some plastic tubings, or some disposable instrument, use this commercially, because commercially this becomes cheaper and easier way of sterilization, as this sterilizes the instrument over the low temperature. Next is chemical sterilization. That means it will cause heating of the tissue by some bactericidal agents, which will destroy the organism and will lead to sterilization. Next is gaseous sterilization. Ethylene dioxide gas is used to sterilize the instrument, that is the ETO sterilization. Lastly, mechanical, that is by filtration. So use various size of filters. With smaller size will eliminate the filtration of the, what you call, the small viruses. So in that case you can use this for sterilization of the liquid, that is better for sterilization. Autoclave. What is the basic principle of autoclave? Autoclave is direct steam contact at a required temperature and pressure for a specified time. So all these three parameters are very important: temperature, pressure, and time. All three should be met so that you achieve a sterilization by autoclaving. So thus there are four parameters in steam sterilization. One is the heat should be moist, that is steam. So water evaporates and it forms a steam, and that steam is used for sterilization. Second is the pressure. Pressure, you should keep the pressure at 15 pascals. So normal pressure, atmospheric pressure is 1. So you have to keep it pressure is 15 pascals. Temperature that has to be achieved is 121 degrees Celsius. So this is beyond the water boiling point, that is more than 100. So 121 degrees Celsius, and the time is also very important, for at least 20 minutes. So if you use all these four parameters for sterilization, you will achieve a sterilization by autoclaving. One is moist heat, second is the pressure, that is 15 pascals, and temperature is 21 degree, and time is 20 minutes. All the metals instrument are sterilized by autoclaving. Almost all instrument that we are dealing in general surgery is sterilized by autoclaving, except the scissors, because if you sterilize the scissors repeatedly, it loses the sharpness and becomes useless. Plastic tubing, the tubings which do not withstand a higher temperature like 121 degree, then those are not used for sterilization by autoclaving. Next is, when we come to how do you describe an instrument. When an instrument is given to you in an exam, how do you describe? They should be described in this order. First is, you should be able to identify the instrument. What is the instrument like? Second is, what are the various parts of the instrument? Third is, uses, in which surgery, at which step of surgery you have seen the use of this instrument. And finally, the method of sterilization. So for most of the instrument, metallic instrument, it will be autoclaving. Now coming to the instrument, there are various, we have divided this into various groups of instruments, so that you can understand the instrument a little better. So first is skin and subcutaneous tissue retractors. Retractor means it will pull the tissue so that you have a better view of the organ or the pathology which you are going to operate. So retractors that are used for only skin and subcutaneous tissue, there are group of retractors. Second is retractors that are used for retraction of the entire thickness of the abdominal wall. So when you are doing an intra-abdominal surgery, use this type of retractors. Third is artery forceps, or also called as hemostats. So forceps means to compress or to grasp any tissue. So the instrument which we use to grasp a tissue is called as forceps, and if it is used to grasp the arteries or a vessel or to achieve hemostasis, it is also called as artery forceps or hemostatic forceps. Next is tissue holding forceps. The instrument which are not used for holding the vessel but to hold the tissues, you call it tissue holding forceps. Next we have a right angle dissecting forceps, clamps, towel clips. Towel clips are the instrument to secure the drapes or the towels to the patient. When you have draped the patient with the betadine solution and you are ready with the surgery, you drape the patient with sterile clothes and you secure it with the towel clips. Forceps, scissors, stone holding forceps. There are various types of stone holding forceps. We'll discuss needle holders and other miscellaneous instruments that we'll be talking in a later slide. So, skin and subcutaneous tissue retractors. There are commonly used three types of skin and subcutaneous tissue retractor. One is the Langenbach's retractor, second is the Zerni's retractor, third is the Sen's retractor. So, see this. This is Langenbach's retractor. How do you identify Langenbach retractor? Langenbach, L for Langenbach. So, it is an L-shaped instrument. First point is the identify the instrument. This is a Langenbach L-shaped instrument. This is used for skin and subcutaneous tissue retractor. This part of the instrument is called as the blade. This is the shaft and this is the finger bow. So this is the blade, this is the shaft of the instrument. So point 2, we have described the parts. Now the uses. As the name suggests, it is used to retract the skin and subcutaneous tissue. You have to tell some surgery, as in when you have seen it while doing an open cholecystectomy. In order to incise the anterior rectus sheath, you retract the skin and subcutaneous tissue. And lastly, the method of sterilization, how do you sterilize this instrument, remains the same, that is the autoclaving. Next instrument is Zerni's. So this is a Z-shaped instrument. So you can see CZ. So you can remember the Z-shaped instrument is Zerni's skin and subcutaneous tissue retractor. This is blade. This is one of the blade. This is the prong, and this is the shaft of this instrument. So this is the solid blade, and on the other hand, that is present in the opposite direction, it has two prongs, whereas the shaft. So this part has been described. Now the use. So this is also used similarly as Langenbach retractor, that is for retraction of the skin and subcutaneous tissue when you're doing an open cholecystectomy, when you're doing an open hernioplasty, when you're doing an open appendicectomy. Third type of skin and subcutaneous tissue retractor is this. So this is similar to the previous two. So you can appreciate this is one blade, and on the other blade you have a cat's paw type of pattern, and then you have a shaft. You can appreciate this is the shaft. So this is called a Sen's retractor. These are the parts. The one blade is having a cat's paw like tissue retraction, another is solid blade present at the right angle. So uses remains the same: skin and subcutaneous retraction while doing an open cholecystectomy, while doing an open appendicectomy, while doing an open hernia. And the method of sterilization remains same for all this instrument, that is autoclaving. Next comes the abdominal wall retractors. So as the name suggests, it retracts the entire abdominal wall. So that instrument has to be very thick and stout, very big instrument as compared to the skin and subcutaneous tissue retractor with this size. So first is the Devers, then you have a Doyne's retractor, third is the Morris retractor, and lastly the Balfour's retractor. We'll discuss one by one. So this is an S-shaped instrument, almost an S-shaped instrument. It is called as Devers retractor, abdominal wall retractor. You can remember Dever for liver. So basically it is used to retract the liver in the upper abdomen. So you have to see the structure that is beneath the liver. So what are the structures beneath the liver you want to operate? As in the case of open cholecystectomy, when you are doing an open cholecystectomy, use this to retract the lower lobe of the liver. Then if you are doing a CBD exploration, or you are doing a duodenal perforation repair, or some gastrectomy, or any structure that is in the vicinity with the liver, you use this to retract. For pelvic structures also, any pelvic you can use to retract it with the uterus or the bladder when you are doing any pelvic surgeries. Also you can use this. What is the part? This is the blade part, and this is the shaft. This part is the shaft of the instrument. Then what is the use? I already told you. And the fourth is method of sterilization remains the same, that is autoclaving. Next, this is a Doyne's abdominal wall retractor. Mind it, this is the blade of the Doyne's abdominal wall retractor. This is the handle or the shaft, or this is the finger bow. You keep your finger, your index finger in this, and then you retract it, pull it down. So the blade, you can observe the blade, it is actually a C-shaped blade, and it has a curve over the surface also. This is very important, a curved surface and a C-shaped blade. You can appreciate this. This is used to retract the abdominal wall. The uses is when you're doing an intra-abdominal surgery, some bowel anastomosis, some bowel resections, and any structure, any surgery that is intra-abdominal, you use this to retract the abdominal wall. Method of sterilization remains the same, autoclaving. This is called as Morris retractor. It is almost similar to your Doyne's retractor. Similar to the Doyne's retractor, I'll show you. Doyne's retractor is similar to Doyne's retractor, but the blade is square in this case. It has an what you call the similar curve, a C-shaped curved surface, but these angles are acute. There it was a round C-shape angle, but here it is sharp. There is a right angle. It is placed at the right angle. This is the blade part of the instrument. This is the handle, and this is the finger bow. The method of sterilization remains the same, that is autoclaving. Next instrument is basically this is called as Balfour's self-retaining abdominal wall retractor. It is basically an assembly of various types of retractor. So this is Balfour's. One is this is retracts the right side of the abdomen. This will retract the left side of the abdomen, and this is the screw where you can open and retract it further. And this is one of the Doyne's blade that fits into this. We can apply a third retractor. So once you place this, it is self-retaining. It is not going to move. You don't need an assistance for this. For all other retractors, you have to have assistant to hold this instrument to keep in place and to retract the abdominal wall. But once you put this assembly and retract it, open it, it will self-retain itself, and even with one assistant or without assistance also you can do surgery. Next, coming to forceps. So what are the various parts of the forceps? Forceps are the instrument that holds or grasps the tissue. So it has various parts. One is blade, or also called as jaw. Next part is the joint. Third is the shank, or also called as the shaft of the instrument. Fourth is the finger bow or a finger ring. And fifth is the ratchet or the lock of the instrument. Next instrument is artery forceps. So it is available in various sizes: large, medium, small, and the smallest artery forceps is also called as mosquito, because the tip of the this mosquito forceps, or the what you call the jaw of the mosquito forceps is so fine that you can hold the leg of a mosquito. So these are the various sizes, and the smallest of the artery forceps is called as the mosquito also. So this is basically, as the name implies, it is used to hold the arteries to stop the bleeding. So it is also called as a hemostatic forceps. So there are various types of hemostatic forceps. You have this type in which you have a straight variant. This is straight variant with a perpendicular or transverse serration you can appreciate. And in curved also you will have a transverse serration. It enhances the grip of the instrument. So next is tissue holding forceps. In tissue holding forceps there are three types. One is Ellis tissue holding forceps. Next is the Babcock tissue holding forceps. Third is Lane's tissue holding forceps. So this is Ellis tissue holding forceps. This is a traumatic tissue holding forceps. The complete name is Ellis traumatic tissue holding forceps. This is the blade part of the instrument or the jaw. This is the joint. This is the shaft or the shank. This is the ratchet or the lock, and the finger bow. So the peculiarity is over the tip or the blade part. You can appreciate the tooth on both of the blades. So this is the one blade that is having the tooth, and this is another blade that is having the tooth. The beauty is the tooth of one fits into the groove of the other instrument. So they are snugly tight, so the tissue cannot slip. But the problem is this is traumatic. So it will traumatize the tissue which you are holding. So you cannot hold a delicate tissue with this forceps, because it will cause trauma and it may cause the rupture of the tissues also. So this is traumatic. This is used for tough structures. So what are the tough structure? For some fascias, important. If you want to hold some important fascias, you can hold with this. Some skin and subcutaneous tissue, thick and skin subcutaneous tissue, you can hold with this. How do you sterilize this instrument? Remains the same, by autoclaving. Next is Babcock forceps. This is typical Babcock forceps. This is the blade. This is the joint. Joint is of box type. Then you have a shaft, finger bow, and the ratchet. So the peculiarity or the difference lies in the tip. This is a bulbous end. Bulbous end with central fenestration or central hole without any tooth. This is a Babcock's atraumatic tissue holding forceps. As the name implies, it is not going to traumatize the tissue that it is holding. So it can be used to hold delicate structure as in bowel, as in ureter, as in some other important like a vase as well as your spermatic cord when you are doing a hernia surgery. So it is a delicate instrument or traumatizing tissue forceps. But if there is bowel is inflamed or structure that is you are holding is inflamed, still it can cause trauma to that structure. So it should not hold a inflamed bowel or inflamed structure with this forceps. Next is Lane's tissue holding forceps. So this is similar to the previous instrument. That is, this is the shaft. This is the short shaft. Then the joint. Then this is the shaft, and this is the finger bow, and this is the ratchet. The difference lies over the tip. It has a bullous end with tooth on both the blade, and the tooth fits into the groove of the other instrument. So this is also a traumatic instrument. So yeah, it cannot hold a delicate structures like bowel or any ureter or vas deferens or other structures. So you have to hold thick fascias and thick aponeurosis of the abdominal wall to retract. How do you sterilize those instruments? This is purely by autoclaving. Next is right angle dissecting forceps. It has various names and various subtypes. One is mixture. It is also called as right angle dissecting forceps, also called as mixture. Then is something called as Lahaye's right angle forceps, and there is something called as Moynihan's cholecystectomy forceps. So this is a right angle forceps. You can say the blade is at the right angle to the instrument. This is the blade part. This is the joint, shaft, finger bow, and the ratchet. What is the basic difference between a right angle or a Lahaye's right angle forceps with cholecystectomy forceps? So this is 90 degree. It is exactly 90 degree. So this is called as Lahaye's right angle forceps, and the smaller variant of this also called as mixture. Whereas this angle is not 90 degree, but this is approximately 70 degree. This was devised by Moynihan particularly for doing an open cholecystectomy for dissection of cystic duct and cystic artery. So it has an angle that is 70 degree angle, not 90 degree as compared to this. Plus it has a serrations starting from the tip of the blade to the joint, up to joint. So here, but the serrations are there, starts at the tip but ends midway between the blade. So this is the basic difference. The uses remains the same for all of three. These are used to hook or ligate a tubular structure. As in cystic duct, you dissect the cystic duct around and then you hook this and pass a suture and then can ligate the cystic duct, cystic artery, or you want to lift the ureter, then you can use this for if you're doing a uterolithotomy or any surgery that necessitate the elevation or holding of the ureter. So you can use this. This is a traumatic instrument. You do not hold the structure but you hook the around the structure and then you can ligate. How do you sterilize? Remains the same, that is autoclaving. Next is the clamp. There are various types of clamp: Cocker's vascular clamp, Doyne's intestinal occlusion clamp, and last is intestinal crushing clamp, that is Pear's crushing clamp. These are various clamps. This clamp basically means to occlude some luminal structures. So this is for vessels. If you occlude this, use this Cocker's vascular clamp, it will occlude some major vessels. So how does a Cocker's clamp look? So this is a typical Cocker's clamp. This is the blade, the joint, the shaft, the finger bow, and this is the ratchet. So what is the difference between a artery forceps and a Cocker's artery clamp? So the difference lies over the blade. You could see one blade has a tooth with corresponding groove in the other blade. So when you lock it, it stays there. It stays there. So when you're doing a nephrectomy, you want to ligate the hilar structure as in renal artery and a vein. So what you do is this is your artery, suppose. So if you clamp it with an simple what you call the artery, so what happens? There is a tendency when the structure is larger, big enough, so we cannot occlude the entire structure. So there is a tendency of the structures to slip. But in the case of Cocker's clamp, what happens when you close it? this end will close up first. So what happens? There is no tendency of slipping of the structure. So the structure is not going to slip. It is very important when you are ligating important arteries, as in your renal artery in a case of nephrectomy, or a splenic artery in a case of splenectomy. So this is a Cocker's vascular clamp. Next is Doyne's intestinal occlusion clamp. This is important. It occludes the lumen, and here it is crushing clamp. So it will crush the lumen. So this is Doyne's intestinal occlusion clamp. You can appreciate this. It has a long blade, a joint, a shaft, a ratchet, and this is the finger bow. Most important thing to be noted is available in two forms: it's a straight or a curved. Plus the serration are longitudinal. All instruments, their serrations are transverse, but in this case the serrations are longitudinal. This is the straight variant, and you have curved variant also. So this is very important. Mind it will occlude the lumen. It is not going to destroy the wall. So normally you apply it over the bowel segment that is to be anastomosed, because it is not going to hamper the vascularity of the tissue per se. So this is used for occluding the lumen, so that the fecal contamination in the field when you are doing a resection is not there. You minimize that contamination. Next instrument is intestinal crushing clamp. This is a very different instrument. You can make it out. This is the blade part, this is the joint part, and this is the two shaft. So what happens? There are four joints. There is no single joint. In most of the instrument you have seen previously, there were only one joint, but here you have a four joint. Plus at the tip you have this tooth with a corresponding groove that fits into. When it is closed, it fits exactly. So this is the crushing clamp. So when you apply this clamp, it will going to crush the wall. So this cannot be applied over the bowel segment that is to be anastomosed. So this will be applied over the bowel segment that has to be removed as a specimen. So you apply this as a instrument. How do you sterilize this? The sterilization remains the same, that is the autoclave. So towel clips. Towel clips are used to secure the drapes or the towels to the surgical site in order to prevent the contamination. One is the Dowens towel clip, backhouse towel clip, and the Moynihan's towel clip. Dowens towel clip and the backhouse towel clip are the two commonly used towel clips in the surgical field. So this is the Dowens towel clip. This is one of the prong, this is the blade, and this is one of the prong. So you have to compress this serration so that this blade will open, and then you can secure the towel as the tip is very sharp. Second is, this is the backhouse towel clip. Backhouse towel clip looks like an artery forceps. This is the blade, this is the joint, this is the shaft, the lock, and the finger bow. But the difference is over the blade. The blade does not meet, but only at the tip. It is the tooth instrument. So when you close this instrument, it will close and damage or puncture the this sheet. And the third is the Moynihan's towel clip, not that commonly available. The difference is, you can see this axis of the instrument. The blade of this instrument lies in the axis, whereas in this backhouse towel clip, the plane of the blade is this, but the prong is on the other plane, whereas it lies in the same plane. It has two tips on each blade. It has a very shorter blade. So this is the Moynihan's towel clip. The uses of this instrument all are used to secure the towels or the drapes over the patient, and the tubings and the cautery cables and the electric cables while doing the surgery. How do you sterilize this instrument? Is by autoclaving. Now forceps. There are various types of forceps. One is tooth, one is plain or also called as thumb forceps. Third is the Adson forceps, and fourth is the DeBakey forceps. So this is a typical tooth forceps. It has two blades. This is one of the blade. This is another blade. This is the transverse serration where you keep your finger. You hold it like a pen, exactly like a pen. You pinch it like a pen. So when you close, one blade has a tooth, another blade has a groove, so it fits perfectly. So this is very traumatic. So this is traumatic forceps. So you cannot hold delicate structures like in bowel, ureter, CBD, or cystic duct, because it will going to pierce through the tissue and it will traumatize the tissue. So this is used to hold the skin and subcutaneous tissue when doing an incision, when doing entering the doing a laparotomy, or while closing you retract the skin and subcutaneous tissue. Use this forceps. Next is plain forceps. Plain forceps does not have this tooth. Almost it remains similar to the tooth forceps, but the only difference is the tip is rounded, plus there is no tooth over the tip, and against that there is serrations that is present. It increases the holding capacity of the forceps. So this is atraumatic. So because it is atraumatic, it can hold delicate structures like bowel or ureter or spermatic cord or vas. Any other delicate structure can be held. The problem with this is it does not have that good quality holding capacity as compared to your tooth forceps, because the grip is little loose. Third is Addison forceps. So Addison forceps is also tooth forceps. You can see it is a bullous, it is wide, whereas the tip is very narrow. Where the blade is the tip part is very narrow. It has similar tooth on one blade and corresponding groove on the other blade. So this is Addison type of tooth forceps, and this is Addison type of plain forceps. This is used for fine surgery when you are doing a very small cyst, or you are working very closed space where you want very fine surgery, fine dissection, then you can use the Addison forceps. Lastly is a DeBakey vascular forceps. It is called as a vascular forceps. So because of poor quality of holding of the plain forceps or a tooth forceps against the tooth forceps, and traumatizing tissue quality of the tooth forceps, so this is the in between instrument. It has fine serration, very fine serration over the both blade, so that it makes it better to hold the tissue as compared to the plain forceps. Plus it offers the good holding capacity of the tooth forceps of the tooth forceps, but it will not going to traumatize or destroy the tissue. So it is can be used to hold the vessels also. It is not going to puncture the vessel or damage the vessel. So it can be used for anastomosing the bowel, for anastomosing the ureter also, because it's not going to cause trauma, minimal trauma to the tissue. How do you sterilize all these forceps? All these forceps are sterilized by autoclaving. Next is scissors. There are various types of scissors. I'll discuss only three types most commonly used. One is Mayo scissors, next is a Metzenbaum scissors, and third is the Makendo scissors. So these two scissors are commonly used and commonly seen in an OT, Mayo scissors and Metzenbaum scissors. So this is Mayo scissors, this is Metzenbaum scissors, and this is Makendo scissors. How do you differentiate? Mayo scissors is basically for thick tissue cutting or suture cutting. These are very thick scissors. You can appreciate the blade, it is very thick as compared to the Metzenbaum and Makendo scissors. These are very slender, very sleek scissors. It is a very thick. So it is used to cut very fascias or even tubings, even meshes, and sutures also use this Mayo scissors to cut. This is Metzenbaum, very slim scissors. This is the blade part, this is the joint part, this is the shaft, and this is finger bore. Important thing to be noted is there is no ratchet or lock. So this instrument scissors are without lock. There is no lock in the scissors. There are two group of instruments who do not have lock. One is the scissors, second is the stone holding forceps, that will be discussed in later slide. So this is Mayo scissors, it's a stout scissors. This is Metzenbaum scissors, very sleek and slender scissors. It is available in straight and a curved variety both. So what is the importance or what are the uses of this instrument? This is basically used for fine dissection or tissue dissection when you are doing a surgery. This is for dissection, this is for cutting thicker tissues and tubings and your what called the suture. Makendo scissors almost remains the same. It has a sharp tip. Your Metzenbaum has a sharp tip, where it is a slightly rounder tip and smaller blade as compared to the Metzenbaum scissors, and slightly thicker, you can say, not that slender as compared to the Metzenbaum scissors. How do you sterilize those instruments? That is by autoclaving. Next is stone holding forceps. There are various stone holding forceps. One is cystolithotomy forceps, one is Desjardins, and one is Randall's type of tissue stone holding forceps. This is cystolithotomy forceps. I already told you there is no lock in two instruments. One is the scissors, another one is the stone holding forceps. There is no lock or a ratchet. You can see this is the blade part, this is the joint, this is the shaft, or this is the finger bow. So important difference you should note. One, there is finger bow is present in one of the this thing the blades, and finger bow is not present. It is an open end in the other part. So you hold it like this. You put a finger or a thumb inside this finger bow, and your forefinger lies over the this area. Your forefinger lies over this area. So when you're doing a cystolithotomy of a cycle stone, you use this to remove the stone. Next is Desjardins tissue holding forceps. This is a typical Desjardins tissue holding forceps. This is the blade. This is the finger bow. This is the shaft. This is the joint, and this is the blade part. The important thing you should note is basically this bullous end with the central fenestration of the blade. This is important for holding this stone for smaller stone. So when you are doing a open colodoco lithotomy, when there are CBD stones, when you are exploring the CBD, you use this instrument to remove the stone from this CBD. This will, because the CBD stones are smaller, it will come very easily with this Desjardins colodoco lithotomy. Specifically, it was designed by Desjardins for exploring the CBD and removing the stone. Next, this is Randall's stone holding forceps. Mind it, most of the colleges have this Randall's stone holding forceps. This were devised for holding or removing the stone into the renal kidneys. So they are placed at various angles. It is available in various sizes and various angles. One is straight, one is now almost 90-degree, one is 270-degree curve. So they are available in various curves. They have small serrations over the tip. They do not have a cup-like features as in the Desjardins stone holding forceps. They have a flat central central fenestration with transverse serration that is present, and they are available in various angles. One is straight, I told you straight, almost straight. This is 90-degree almost. This is 270-degree, and this is the finger bow. There is no ratchet. This is the blade part. This is the joint and the blades. So what are the uses? One, cystolithotomy forceps. It is used to remove the stone from the bladder, urinary bladder. Desjardins is for removing the stone of the CBD or the common hepatic duct. It is also called as colodocolithotomy forceps. And third is the Randall's stone holding forceps that was used to remove the stone from the kidney, from the renal pelvis. How do you sterilize this instrument? Same like the other instrument, that is autoclaving. Next is needle holder. What is a needle holder? Needle holder, as I already told you, this is the blade part, this is the joint, this is the shaft or the shank, finger bow, and the ratchet. The peculiarity of this instrument or a needle holder is it has very shorter blade as compared to the shaft length. So the blade is very short. Why the blade is very short? Because you want it to when you apply a pressure over, or when you lock this, maximum pressure is applied over the tip, because you are going to hold a metal, that is the needle, whereas all the other instrument which we used to hold the tissue, soft tissue. So you have to hold the metal with this. So you should have a very firm grip over the metal. That's why once the blade part is shorter, when you apply X amount of force, the pressure that is exerted over the blade will be 2x. And the next peculiarity is over the blade, it will have crisscross serration. You can say this is not transverse, this is not longitudinal, but crisscross serrations. It is crisscross with a central groove. Now this is said to fit in the needle to accommodate the curve of the needle, but you do not hold the needle here. You hold the needle at the tip. So it is not going. It is useless. This is not hold. But it is said that this groove is to accommodate the curve of the needle. Nowadays, you don't have or don't get this type of needle holder with the crisscross serration and central groove, because what happens with repeated use, with repeated friction between the needle and this metal, this groove becomes very blunt and the needle becomes useless. The needle holder becomes useless. Nowadays, we have a tungsten carbide coating over the tip of the needle holder that does not rust or that does not fade away with time with use. So this is better needle holder available nowadays. So what is the use of this needle holder? Is while suturing, while closing the skin, or while closing the fascias, or while taking some bite through the tissue, also use this needle holder. How do you sterilize? Sterilization remains the same, that is autoclaving. Now coming to the miscellaneous instruments. One is Kelly's proctoscope. This is obturator. This is proctoscope. So this is used to do proctoscopy in OPD basis. So in OPD, when you have a patient with some anorectal disease, as in bleeding PR, perianal pain, or some mucus discharge, or something coming out per rectum. So in that case, to examine the patient, you use this instrument. It's called as Kelly's proctoscope. This is called as the obturator. This is the proctoscope. Nowadays we have a self-illuminating, that is, there will be a light that is placed here so that you can visualize the entire part of the lower part of the rectum and the anal canal better. So what is the indication of using this? To diagnose hemorrhoid, to diagnose fissure, or to see any rectal polyp is there or not, to do an examination of the patient. How do you sterilize this? As this area which you examine with the Kelly's proctoscope is a dirty or already infected area. So on an OPD basis, you can dip it in the Savlon solution or a glutaraldehyde solution if possible. It can be used in an OPD basis. And again, you can wash this instrument with spirit and saline, and then you can be reused, because there is always a bacteria. The bacteria is always present in your anal canal region. So there is no need of sterilization. But in the case of OT setup, when you are doing some surgery for hemorrhoids or fistula, in that case you can sterilize this by doing an autoclaving. Next is Lister sinus forceps. So this is Lister sinus forceps. It looks similar to your artery forceps. So it has a blade part. This is the joint, this the shaft, and the finger board. Mind it, there is no lock. There is no lock. In artery forceps you have a lock. Second thing, there are serrations that are present transversely, as similar to the what you call the artery forceps. Artery forceps are sharp at the tip, but this is blunt, rounded edge. So it is rounded, and you can see there is a gap in between this instrument, whereas in artery forceps there is no gap that is left behind. So this is used for doing IND by Hilton's method. What is Hilton's method of IND? In an areas where you have neurovascular bundle, as in your neck, your axillas, and your groin, where you have a lot of neurovascular bundle and there is an abscess. So if you give an incision and your blade reaches this, it may traumatize, or it may cut the artery, vein, or nerve, whichever structure is nearby. So in order to avoid injury to this structure in this vital area, what we do is you just give a skin incision. You don't go deep inside the subcutaneous tissue and inside. You just give a small skin incision, and then you repeatedly dilate with this instrument, repeatedly bluntly dilate with the instrument, and once the pus comes out, then you can evacuate and suck all the pus. So you use this for blunt dissection in the abscess cavity to avoid injury to the neurovascular bundle. What is the method of sterilization? Remains the same, that is the autoclaving. Next is the BP handle, that is also called as Parker handle. Most commonly used BP handle is number 3 and number 4. And blades. So number 3 number 3 blade, which blade fits 9 to 17. Remember, 9 to 17 are the blade number which fits into a 3 number BP handle. Most commonly used is 11, this blade, and the 15 number, this blade. These are the two commonly available or used blade with handle number 3. And handle number 4, that is above 18. 18 and above blades are used with handle number 4. So most commonly available is 21, 22, 23, that are fits into the 23 number, 4 number BP handle. Why do you use a BP handle? For giving any incision in a case of doing any laparotomy, open cholecystectomy, open appendicectomy, or open hernia surgery. Use this 23 number blade for doing a large incision, giving a large incision. Whereas for if you are doing a laparoscopic cholecystectomy, use 11 number to give a stab incision or a small incision. And this, if you are doing very small cyst surgery, any small incision, 1 centimeter, less than a centimeter, or 2 centimeter incision, then use this 15 number blade for a finer incision and finer dissection. Next instrument is Rampley's sponge holding forceps. This is the typical Rampley sponge holding forceps. This is the blade part, the joint, the shaft, the ratchet and the finger bow. The blade has a peculiarity, that is, it has a bullous end. It is a bullous, very wide, rounded structure with a central fenestration with a transverse serration. Transverse serration. So this is called as Rampley's sponge holding forceps. As the name implies, it is used to hold the sponge while painting the patient with betadine and spirit and Savlon. So when you are starting your surgery after patient is given anesthesia, you have to paint it with spirit, betadine, and what you call the Savlon solution. So you hold the gauze or a sponge over the sponge holder, and then you paint the patient. Other uses is when doing an open cholecystectomy. When doing an open cholecystectomy, use this instrument to hold the fundus of the gallbladder and retract it cranially, and you use one to hold the Hartmann's and retract it infrolaterally, so that you open up the Calot's triangle and do the surgery. Another is you can place a sponge over this and use to mop intra-abdominally when you have a bleeding and you have to clear the field or area, so that you have a better visualization. You can place a gauze over the tip or the sponge over the tip, and then you can mop intraoperatively. How do you sterilize this instrument? Is same by autoclaving. Next is Chittle forceps. You must have seen this is on an OPD basis. This is the blade part. This is the joint. This is the shaft and the finger bow. There is no ratchet. It is not. There is no ratchet available. So this is basically used to transfer the instrument, sterilized instrument from one place to another. As in, you are doing some surgery, you need some instrument from the sister, so sister will use this instrument to hand the instrument, to remove the instrument from the box and transfer it in your hands. So this instrument is kept dipped into the Savlon solution. That Savlon solution will achieve a high level disinfection. It is always changed on every 15 days to have a good high level disinfection of the solution. So this is not sterilized ideally. It is kept in an OPD basis or even in OT unsterile, but the tip is kept dipped into the Savlon solution, so it achieves a high level disinfection. And then you can transfer instrument or any sterilized instrument or gauze piece or pads to the surgeon or the someone doing the dressing. So thank you. Any questions if you have, you can yeah, drop me a message or you can call also. Thank you.